At home with your newborn, Part 2, Infant Stool. Many parents have questions about their newborn baby's stool, otherwise known as bowel movement or poop. The following pictures will show you some examples of what normal, healthy newborn stool can look like. We will also show you some pictures of stool that is not normal and discuss when you should call a doctor. Please be aware that this video includes actual photographs of baby stool. Some people may find these pictures unpleasant to look at. If your child is a patient at the Pediatric Primary Care Center, PPC, at Cincinnati Children's Hospital Medical Center, these questions can be answered by a simple phone call to the Pediatric Primary Care Center, PPC, at Cincinnati Children's Hospital Medical Center at 513-636-7722, option 4. A nurse is available 24 hours a day, even on weekends and holidays when the office is closed. Normal newborn stool. Meconium stool. In the first few days after birth, you may see a greenish, black, tarry, sticky stool that looks like motor oil in your baby's diaper. This is called meconium. When your baby is 2 to 4 days old, it will become lighter in color and less sticky. This is a sign that your baby's digestion is working well. If you have any concerns, call the PPC to speak with a nurse. Breastfed baby stool. If your baby is breastfed, the stool will be yellow or slightly green and have a mushy, creamy, or seedy consistency. It may look like very loose diarrhea. It can also change colors if you eat something different. Formula-fed baby stool. Formula-fed babies have pasty, peanut butter-like stool. Iron-fortified stool. If your baby is taking a multivitamin with iron, the stool may be very dark green in color. Dark green stool is nothing to worry about, but if the stool looks black, you should call the PPC to talk with the nurse. Stool with partially digested food. If your baby is a newborn, it will be a few months before you see stool that looks like this. When your baby begins to eat solid food around 4 to 6 months of age, you may see chunks of food in it, or it may be tinged with food colors. Not to worry. You're probably seeing this because certain foods are only partially digested or travel down through the intestines so quickly that they don't have time to completely break down. Abnormal stool patterns. The following photos show stool patterns that are not normal. Call the PPC nurse if you see any of the following. Diarrhea. Diarrhea is very runny and appears to be made up of more water than solids. It can be yellow, green, or brown and can seep or explode out of the diaper. Diarrhea may have many causes. Call the PPC and speak to a nurse if it lasts more than 1 to 2 days or has visible blood or mucus, or your baby is not eating or urinating as much as usual. Stool with mucus. Greenish stool streaked with shiny strings means that there's mucus in it. This sometimes happens when a baby drools a lot or has a cold, since mucus in saliva often goes undigested. But mucus in stool can also be a telltale sign of an infection or allergy. If it lasts for 2 days or more, call the PPC triage to speak with a nurse. Constipation. Not all babies have a bowel movement every day. If your baby's stool is soft, the baby probably is not constipated. However, if your baby's stool is hard and looks like little pebbles, as in this picture, he or she is probably constipated. Keep in mind that many babies appear to be straining when having a bowel movement. If the stool is soft and the fussiness does not last more than a few minutes, straining is not likely a sign of constipation. Bloody stool. If you see blood in your baby's diaper, you should call the PPC to speak to a nurse. Sometimes blood in a baby's stool is bright red, as in this picture, and sometimes it's black. Bright red blood can show up for a few different reasons: a milk protein allergy, a tear in the anus from constipation, or a bacterial infection. Black blood can appear as a result of breastfeeding on cracked, bleeding nipples. Call PPC to speak with a nurse if you see either of these. White stool. White stool is very rare. While there is no picture in this video of white stool, keep in mind that white stool is not normal. Normal stool may be pale yellow, but if your baby's stool is ever completely white, contact the PPC to speak with a nurse, as white stool could be a sign of a liver problem. When should I call the doctor? Remember that until your baby is 2 months old, any fever of 100.4 or higher is an emergency. Call the PPC right away, even if it's in the middle of the night. Thank you. Don't forget, PPC Triage Nurse, 513-636-7722, option 4.